Welcome to the MFR Coaches podcast, where we talk about how you can create a six-figure MFR practice. I'm your host, Heather Hommel. Not only have I been practicing MFR for 11 years, I'm also a life and business coach, especially for MFR therapists. My goal is for you to understand how to get fully booked, how to talk to your clients, and how to make sure they understand what's possible for them with MFR treatment. I'm here to help you stop under-earning, overworking, and burning out. I'll lend support so you can create the MFR practice you've always wanted. Learn how you can do it too, even if you live in a tiny town, and even if you're just starting out, and even if you've ran your practice for years. Let's go. Hey, everybody, and welcome back to another episode of the MFR Coaches podcast. I'm joined today by one of my former students. They are a myofascial release therapist and owner of Zest Myofascial Release in Jacksonville Beach, Florida. Jamie Bomtempo, welcome to the program. I'm so excited that you're here.
Thank you so much, Heather. Really appreciate you having me on here.
Yeah. So a while back, there was a bunch of talk about hypermobility, Ehlers-Danlos syndrome, and both for treating clients that have that. And then you spoke up in our group and you were like, not only do I treat that, but I also have that. So we thought this would be you'd be a great person to have on the podcast to talk about hypermobility and how it affects you as an individual and also affects your practice. So can you tell us basically how that works for you? What is it like having that diagnosis and how does it affect your practice?
So ever since I've been a therapist, I'd say I've noticed that I get fatigued very easily. And also I've had mystery pains since I was a kid. So I think that the way that it affects me as a therapist is that I've had to modify how I treat. Before I was an MFR therapist, I was a hospital-based neuro ICU OT. So it was a lot of lifting of large humans. And I remember people telling me, you just have to have better ergonomics. You can transfer people, you just have to watch how your body moves. But the thing about when you have hypermobility is that we don't have as good proprioceptive input, which is that our body's awareness of where we are in space. So really, I think what made me of course, I'm a better therapist just for being an MFR therapist, I believe, but getting treated really changed my life. I wouldn't even probably be able to treat patients had I not gone for multiple intensives, because what I found for myself and just for patients is that people who are hypermobile, we need that input into our bodies. So the compression that MFR provides is just really, really, our body needs that. And then, there are some ergonomics factors that, you want to make sure that you're getting good leverage. I know that I've seen some really good videos that they put out on the MFR Insight of just tips and tricks. I love those tricks. I've tried things like wearing splints for my hands, but those never seem to really help because I'm always throwing them off. I would use the Oval 8 splints and they just get in the way and I'd just be throwing them and losing them. Kinesio tape sometimes helps, but again, it peels off. So really, I just have to make sure that my hands, especially because I have hypermobile hands too, but I have to make sure that my hands are in a good position. Because if I'm not looking at where my body is, I'll be really cattywampus is a word that I recently learned. I need to just be aware of where my body is and how I'm positioned. Another thing is pacing myself. So I cap myself at 3, maybe 4 patients a day.
Was that decision something you learned inside my program, like that it was safe to cap yourself, like especially if you physically need to cap yourself, and then also knowing how to set your schedule and your pricing so that you could afford to cap yourself at that?
Yeah, like you said, like just basing things on facts and data.
Mhm.
It was also how much am I charging and how much time I'm giving people. My sessions are longer than normal, just in my brain. I'm also an introvert. That's another thing about Ehlers-Danlos syndromes and hypermobility spectrum disorder. A lot of us are not neurotypical, so I'm just an introvert. So I like that one-on-one time with people and I like having extra time. So yeah, an hour and a half is what I've been doing. And then I try to add about an hour if I'm pacing myself well. I will save time at the end to where I'm actually showing them like self-treatment. So I'm not hands-on the whole time necessarily.
Yeah. I think that's really good that you've been able to come up with a plan of how can I do this work that I love, that I'm extremely good at, and also have my body respond in a way where I'm not just constantly fighting my chronic fatigue or my chronic pain that I also deal with because of my hypermobility, right? So it's like you can have any, maybe not any diagnosis, but there can be a lot of diagnoses going on with us as therapists because we're human beings too. And still a lot of room for us to be the therapists that we want to be if we set ourselves up for that outcome. Because I do think that is a push in any industry for this idea of looking successful, or that there's this ideal of success that's just made up. I don't know who made it up, but a lot of people think, oh, you have to be seeing over 20 clients a week, you have to have multiple treatment rooms, you have to do this, do this, do this, do this, and this in order for it to look like success. And I want people to know that they get to create their own success. And you really have to decide based on your own facts and data and how you want to feel in your body at the end of the day and at the end of the week. You have to decide those things for yourself. It's not someone else saying, oh, you are now anointed with success because you burnt yourself out and you worked yourself to the bone, seeing everyone that wanted to be seen. So
Yeah.
I think that you're a
Yeah.
good example of that. And I appreciate you being honest with your numbers, because some people don't realize that 3 or 4 people a day is not only a super appropriate number of people. Lots of people in coaching end up seeing 3 or 4 people a day, but it's readily available for anyone who wants that type of schedule. And you can make money doing
Yeah, I love that.
it. Yeah. Let's talk a little bit about how did you discover your hypermobility and what has helped you along the way knowing that about yourself?
Well, I there were always things when I was growing up that were just indicators, I guess,
Yeah.
that were overlooked. Like, I happened to grow 7 inches in one year,
Wow.
but I had really extreme growing pains. I played sports. I played gymnastics or I did gymnastics. I played soccer, basketball. So I guess I got to back up a little bit. So hypermobility can come along with, it's not a diagnosis in itself. It's a sign or it's a symptom of other things. So you could be hypermobile and have, for instance, like people with Down syndrome, they have hypermobile joints. But what I have is like the hypermobile Ehlers-Danlos syndrome versus hypermobility spectrum disorder. It's not really been confirmed. Technically, I have the diagnosis of hypermobility spectrum disorder, which is they're still doing research on it, but
Spectrum. Yeah.
yeah, it is a spectrum. And so for me, it was as a kid, it was like getting really fatigued, having to be taken out when I was playing soccer. Like I never made varsity soccer because I would get tired. And while I was trying to get into OT school, I had a back injury that just came out of nowhere. Like one day I just couldn't get out of bed. Like I was crawling to the toilet and sweating on my way there. And it didn't seem like at the time there were people telling me that, oh, you must have like lifted something wrong, which could have been, but that also could have been due to my lack of body awareness.
Right. That you don't even know you're doing wrong, right? Like how many
Yeah,
of us go to lift something? I don't know. I hurt my back just taking a shower the other day. So I should probably get checked out for this condition, honestly.
I guess then what really got me thinking is I'm not gonna like tell my whole history because there's a lot, but yeah, like I would start to get really fatigued or like feel like I was about to pass out just being outside. So I don't have very good temperature regulation. There's just so much. There's like dental issues, skin issues. I bruise very easily. I bump into stuff all the time, which is a telltale sign of you don't have good proprioception. Yeah, a lot of injuries, a lot of twisting, my ankle sprains, shin splints, and just the fact that since I was a kid, I could always contort my fingers in ways that, you shouldn't. And looking back, I know that I have family history of this because my paternal grandmother and my mother used to have like contests to see who could bend their fingers back the most. So like that's also cardiac issues. It goes on and on and on. So like some mitral valve prolapse. There is something with this condition that you can actually have. I'm going to call it hypermobile organs, but it's really, there's a term for it. It's viscerotosis, sagging of the organs, which that's how you end up with Chiari malformation, is your brain starts to, your organ starts to sag down.
Yeah. I had it with that actually when I first started as an MFR therapist and didn't like, I kept working on them and then eventually they weren't getting any better. I knew nothing about this, right? And I look back in hindsight and I'm like, I probably should know what that is, what some of these things are, because that's what she ultimately ended up being diagnosed with. And I was probably doing things that were probably a little bit dangerous for that, not knowing that that's what she had.
Yeah, there are some precautions for, Chiari malformation, for example. Or, if they have Chiari malformation, they might also have craniocervical instability. So you want to be really careful
Not to be tractioning.
not to traction the neck. I would also be careful with like doing aggressive rebounding. Because some people, if they have that craniocervical instability, they actually need to wear a neck brace. So for some people.
And most of the time, like, let's just like put a disclaimer out there for everybody that's listening to this. This episode is not to freak you out or to make you think that you've done anything wrong, right? But it's just like having an awareness of this type of disorder and having an awareness of this type of disease process will help you to understand better if somebody has this, and this come into your office. Like, oh, maybe I need to be curious and ask deeper questions. And maybe we're always following the principles of myofascial release. And when you're always following the principles, like the likelihood that you injure someone is very, very low to 0%. But just having this greater awareness, I think, makes us all better therapists. And then you can just ask more curious questions and make sure you're treating your patient to the best of your ability. So that's the whole point in having this discussion. Small disclaimer. Yeah.
Yeah, don't want to scare anyone. So for me, it got to the point where I was having difficulty walking just like from the hospital parking lot to the hospital to go treat my patients. And I had such a rotated pelvis, rotation, upslip. I was all twisted. I got treated by John. And I mean, all that compression that he put into my pelvis, I mean, that completely changed my life. After I got treated in Melbourne, I felt like I could walk like I was 15 again.
I love that.
So, like, the compression is great. And also, I wouldn't say that every person, that's the thing, is like, you can't just assume too that someone like, oh, you have EDS, then I can't traction a limb or do an arm pull or a leg pull, because that's not necessarily helpful either, because someone with EDS could also not have hypermobility.
Oh, okay. This is so good to know, right? It's like just because you see this diagnosis doesn't mean it's so black and white. This would be where you want to ask your client questions because
Mhm.
most of the time, by the time someone gets diagnosed with ADS, is it true that they know what their body can and can't tolerate as far as like pulling or stretching? Do most people have that awareness, or would you say they don't?
Yeah, I would say usually, I mean, if you have a dislocation, you know, it's like
Right? Yeah.
inflamed, red, you can see.
If you're prone to dislocations, it's probably never going to feel safe for someone to pull on you.
Yeah. Or you can have a partial dislocation, a subluxation. So, I mean, unless they're children, they might not know. It just depends. But when in doubt, I start with compression. But yeah, it's such a broad diagnosis. There's a lot of things too, like that I've seen in the hospital, like thoracic outlet syndrome, pectus excavatum, which is where your breastbone is sunken in. So, like that's one thing that I feel like myofascial release can help with that.
Yeah. Well, I mean, it can help with so many things. And like you were saying, just being treated, going for T, like really literally changed your life and your ability to continue on as a therapist. So I think it's really important to be having these conversations because someone may come into a therapist's office that has EDS and the therapist could be so intimidated by that diagnosis or so afraid of hurting someone that they decide that they can't help them. And that's what I want to prevent. Like I want to prevent therapists from deciding ahead of time that they can't treat something that they've never treated before. It's like, how can we create more awareness around these things? And even if you've never seen the diagnosis before, being willing to work with the person because it could change their life. It doesn't mean that you have to take away every single layer of pain, every single layer of dysfunction, but being able to help someone and to just see the person and not the diagnosis can be transformative for the patient.
Yeah. Sometimes it's as simple as asking them, like, is there something that I need to know? Like, do you sub like that? Just
Yeah.
you can assess them for that too. But
Do you sublux? Yeah. Or do you do your arms fall off when you walk down the street?
yeah, and like don't be staying true to the approach too. We're looking elsewhere for the cause. Someone that has craniocervical instability may really benefit from working in the pelvic area. So if there's a fear around working in a particular area because they're hypermobile in that area, then just start in a different area and they can get profound relief from that. And I would also suggest there's like, if you want to learn more about, not that I'm trying to say like, let's look at the diagnosis, but if it makes you feel more comfortable, like there's books out there, there's a lot of education now on this. But there's this book called Disjointed. It's by Jovin. It's navigating the diagnosis and management of hypermobile Ehlers-Danlos syndrome and hypermobility spectrum disorders.
Okay.
Sometimes just learning about the diagnosis can help you, with your comfort level. There's even a section in that book where it talks about like different modalities. It mentions myofascial release. If I underline here, too aggressive treatment can cause rebound muscle spasms. So that's an argument for getting a Barnes trained myofascial release
Right.
therapist to work on,
Exactly. We can always make an argument for someone to get John
Mhm.
Barnes trained myofascial release therapy, right? Like if
Yeah.
people are truly getting this work and if the therapist is really following the principles, again, the likelihood of injury from this, even with a very deep diagnosis of EDS and you're way on one side of the spectrum, you're not going to be injuring someone when you are following those principles and you're really grounded and you're listening to the patient's body.
I'm glad you brought that up too, because a lot of people that have this issue, like just they're not being heard by their therapist or by their physician. So I think just taking the time to validate what they're telling you is actually happening. It's like so many people that have had this label have been gaslit by everybody, like you might be the first person that's actually listening to them and validating what they're saying. And that right there, their nervous system is upregulated. So just listening to them.
MFR therapists, if you've made 50K or more in the last 12 months, are fully booked or super close, it's time to consider joining my program Beyond 100K. Inside this 6-month mastermind, you'll work closely with me and other leaders in the MFR industry to scale your mindset, the way you serve your clients, and the way you sell to your clients. And you'll also have the opportunity to scale how much revenue you create by working on a second offer or hiring another therapist to join your practice. I'll show you how. You'll have access to all my processes as well as access to other therapists who are doing these things too. The best way to grow our industry and create access is by having financially successful business owners in more places. If you are passionate about helping your clients, want to earn more money, take more time off, and be an industry leader, it's time to apply for the Beyond 100K Mastermind. Applications open October 14th through 18th. Apply in the first 48 hours and receive a private bonus one-on-one call with me upon your acceptance. Get on my waitlist by going to www.themfrcoach.com and click the Beyond 100K link. Here's how it works. Step 1, get on the waitlist. Step 2, apply in the first 48 hours so you get that bonus call with me. Step 3, book your free sales call right after you submit that application, and I'll personally answer all of your questions. Get on that waitlist and mark your schedule to turn in your application starting on October 14th. I can't wait to see what you create and how many clients you serve when you scale your MFR business beyond 100K. How does it feel for you to know, like, if you consider everything you went through from childhood to diagnosis, like that everything you did as a kid, like it was an indicator of this greater global thing that you had going on, and just knowing that about yourself, like none of that was your fault. Like the fact that you never made varsity for soccer, like you were never going to make varsity because your body like just wasn't capable of that kind of output, right? It wasn't because you were a poor athlete.
Right.
Kind of like I would feel like, ta-da, like this is the reason. Was that helpful for you?
Yeah, as much as I have come to really agree with John, saying that the diagnosis, this label, it doesn't define you, but just
It gives you some clarity and answers.
it does give you some clarity and like validation that all these people that were telling me that I was faking my symptoms or exaggerating my symptoms, like I was right, Not that I want to be right, but
Well, nobody wants to have anything wrong with them. And people that do want that for attention, like that's a different kind of psychosis, right?
yeah,
So
yeah,
I think it's great for you to be validated. And I just want you to know, like, I think a lot of people listening to this will wonder too, like about some of the things they've experienced and maybe get checked out. It doesn't mean you have to become your diagnosis, right? It's just
exactly.
it's helpful to have as many answers as possible so that you can take care of yourself in the best way possible. Knowing that about yourself, you're probably not going to go and build a porch or lift a bunch of bricks. You know what I mean? And it's just so much nicer to know, like, hey, here's my boundary of what I can and shouldn't do. And I choose to not do the things that I shouldn't be doing.
Yeah. Not identifying with the diagnosis can be a slippery slope because this diagnosis has its own mascot. It's the zebra because there's this like saying in medical school, if you hear horses' hoofbeats, don't expect to see a zebra. So this is like, there's a zebra. You don't expect all these things to happen in person.
And also, like, as this was once a zebra, I think this is now becoming more of a horse. Do you know what I mean? It's like because people are willing to speak up and say, like, I'm having all of these symptoms and more research has been done. And now there are diagnoses for this. And more people have it, not because more and more people are just having it, it's just more studied, right? And so there are more awareness around it, right? So hopefully people can get the help that they need. So you don't have,
Yeah.
it doesn't have to be a zebra type thing. 'Cause I hate
Yeah.
that. I hate that just because it's an unknown thing, it is a zebra type diagnosis, kind of like how gut issues a few years ago, if you suffered from SIBO or anything like that. That was just all in your head. But no, it's like a real medical condition that lots of people tend to have. There are treatments for it. So
there's 13 different types. They're finding that there's like different types of EDS, and they're still, doing research on it. But yeah, I really caution people not to identify too much and like make this like their identity. Like I've gone to these like some of the seminars, and what John is saying like really hit me. Like, do not let what has happened to you define who you are. Like
absolutely.
Coming back to who you really are.
Yeah. And your full potential, even with something that you don't want to have. There's so much available for you, for everyone, all this potential, which I think is great. Like if we just take a minute to talk about your business and what you've created and where you've come from. So you used to work in a large medical facility and you aren't working there presently. Can you kind of talk about the journey from there to your practice that you have now?
So, I mean, like a typical day would be seeing patient after patient, getting a lot of refusals, like when you're in acute care.
Yeah.
And being, having the medical, within the constraints of the medical system, only offering as much as I could within the confinements of insurance is one thing. Having a lot of things dictated as to what I could or couldn't do, like having physicians call me, this person needs to get out of bed, we need to get them out of the hospital. Now I have people who want to come and see me, who have tried everything. Some of them have gone to all the specialists. Quite a few nowadays, people who are hypermobile coming to me because they've tried these other things that didn't work, and they get better. I love that I can actually see the progression. In acute care, it's just a totally different animal. Sometimes meet a person one time and you don't see them again. But yeah, it's a completely different world. I'm able to do things that I wouldn't have been able to do in the hospital setting. Spending an hour and a half with someone is one thing that's unheard of. If I spent an hour and a half with a person in a hospital room, like there something in that room has gone wrong.
That's so nice that you can offer that to your patients in your practice and you don't have to be bound by the confines of someone else's rules. Like you get to make the rules.
Yeah.
And you don't take insurance, right?
Yeah. Well, I offer, I'm out of network. I offer super bills, but yeah, and sometimes we'll get people, they want to use their HSA and they offer packages. But I just like that it's a different feeling having someone come into your office and they schedule an appointment with you versus like, get out of my room. I want to like, my show is on right now.
100% of your clients want to be there, even if they don't want to be there. They're like paying to be there, so they show up a little bit differently.
Yeah.
What has it been like to have your own practice?
Well, you saw me in the beginning. I mean, I had a lot of fear. I'm not saying I don't still have fear, but I wish I enjoyed the ride more, I'd say.
Well, I think too, we can be really hard on ourselves when we are afraid. But the thing is what if the fear doesn't ever go away? You're just afraid of different things as your business grows. And it's usually just fear of the unknown in the beginning. You don't know how all of this is going to work. You can't predict the future. But then you get 6 months or a year down the road, how long have you had your business? You had it for a while before you met me, right?
Yeah. So I think I had it a year before I met you. So it's been about a little over 2 years. And I think I had never imagined myself being an entrepreneur. I never envisioned myself being an entrepreneur because I had this life that I thought was right for me, which was like, getting a direct deposit from my employer.
Yeah. You had the safety of a job, right? I'm doing air quotes.
Yeah.
I do. Now you create your own safety.
It was not exactly my choice, I guess, to start my business. I started my business because I could no longer lift people without having pain all the time and just going home and having to lay down on the couch. And like that was my existence, was putting everything that I had into work and then coming home and being completely useless. So I kind of felt like when I first started my business, I almost felt like it was something that I was forced into. But now that I'm really in it, it's something that I want because this, myofascial release, Barnes trained myofascial release, there's not a lot there's a few in my area, but not a lot. And this therapy helped me so much that like I just felt like people deserve to have this as an option. So
And you deserve to be able to have a career that sustains you exactly how you are designed, right? It's just nice to know. Like, I think maybe if you re-educate yourself or you just decide to tell yourself a different story about how you came into business, it's like, yeah, at the time you might have felt more forced into that. Like it was either
yeah,
that or do nothing or stay injured all the time. But how did you design this exactly for the lifestyle that you want to have? And how amazing is it that you were able to do that while afraid and while not knowing what you're doing and create what you have now?
you're right. I do keep telling myself this story over and over again, and I would like to create a new story that's not
Yeah.
fear-based, but
Yeah.
or like just
Like you're in control of this business. Really, like no one can take it away from you except for you.
yeah. I mean, I've had the ability to do things that I would never have been able to had I been working for someone else, like travel, how much I've been traveling as a result of just my wife being in the tattoo business.
Yeah. But then having the
Um,
flexibility to go with, right?
yeah, seeing all these people sitting there at the tattoo conventions like shrimps and telling them that I can help them.
Yeah. Hey, you should start a travel business when you go with your wife and you can just set up a booth and treat these tattoo artists
Yeah, I wish I could. It's just that that's another constraint that
for licensing.
licensure. I could do it in Florida. If I got a massage license, I could maybe. But
Maybe, yeah. I wish there was more, and maybe someone listening could write into me if you know, write into clientcare at the mfrcoach.com. But like, how do people travel from state to state, either as a massage therapist, a PT, or an OT? Because I think
mhm.
it would be so nice to be able to travel. You know, like how they have traveling nurses. Like, why can't we get some sort of travel voucher? It would be so fun.
Well, they have traveling therapists. Actually, one of
Yeah.
my students is a travel therapist. He lives in Hawaii.
So how do you get licensed for that?
You just have to go and get the license. Like he's right now working in Hawaii, so he has to go and get the licensure in
Oh,
that
so you
state.
just have to get licensed from state to
Yeah,
state. Ooh, that sounds
yeah.
like a big pain. Yeah.
But there's a compact licensure that I think they're working on. I think PTs and speech therapists are getting better traction on that, at least in Florida.
Yeah.
Like getting where you can, if you're licensed in one state, then you can be licensed. I don't know exactly how it works.
That would be nice if there was some sort of like national licensure for all of the modalities so that you could move easier and all
Yeah.
that. Someday maybe they'll have that. That's something fun to think about. Could you share with the audience maybe like what is your favorite thing about having your own private practice now?
Flexibility. I can, if I need to make an appointment, I can go and do that. If I need to go, my parents live not close, but about an hour away from me, and they sometimes need, if I can go there, take time off and go help them. Yeah, I guess I can just make it whatever I want it to be. I can dress however I want, although, I guess that's not really true.
Within reason, right?
Within reason, you have to wear clothes. Yeah, I would say the flexibility is the best part.
I love that. I think that that's such a good aspect of having your own MFR business, especially when you've set yourself up using facts and data, and you really understand your why behind what you're doing and why you're doing it, so it can keep you going and sustain you for weeks or months where things don't seem to be going your way, knowing that business is not linear. Do you feel like your business can be as busy as you want it to be or as slow as you want it to be, and you kind of have that power to turn on the faucet and turn the faucet off?
I'm trying to go with that more because I know that there are some things that I can control and some things that I can't. Like the school year just started, so been sort of slow, but then I try to put my energy in other things.
Yeah. And like, I think too, seasonally, when you know what times of the year, if business is on average slower in the fall when people go back to school, even though it's like still August when we're recording this, but like in the fall
Yeah,
when people go back to school, or is it in the summer, right? It just really depends on the nature of your exact practice. What is a slower time or whatever, then you can predict for that for next year. So if you know that this is slower for you, then next year in June, I would start planning for that, right? Either plan to do your travel during this time, plan to take maybe a seminar, or plan to go and get a T for T during this time and book all your clients on the front end and the back end of that, so that the time isn't wasted, isn't perceived as wasted by you, or maybe use it as a resting time.
yeah, yeah. Like thinking about going to we're here in Florida, we have springs, so like go to the springs, or you can take that time to work on your marketing, which I should be more working more on my marketing right now, but I have my fingers in different pies.
Yeah.
Yeah, or just like planning your vacation around that time.
I'm just looking at your business hours on your website. First of all, your website is very beautiful. I love it. I feel like
Thank you.
your photography like captures your essence. Like you look very friendly, which I know you are, and just it's just a really fun website. Your business hours though are Sunday to Wednesday, which I think
Yeah.
is so amazing, right? So you get Thursday, Friday, Saturday, you have a 3-day weekend every week. That's amazing.
Thursday, I try to set aside Thursday as like my business day where I'm just not seeing patients that day, so I'm available. And if it's I can be if it was a slow week or something, and sometimes I'll see people on a Thursday, I'll open up my schedule occasionally. I try not to. But yeah, I've been seeing people more like in the evening and afternoon because I just know that people tend to be available then and on
Yeah.
Sundays. 'Cause most people work during the day. And just with my wife's schedule, she's in the tattoo industry. Most people like to come on the weekend and get a tattoo. So we try to work our schedules.
That's great. That's a great compromise too. So yeah, I love that.
I've always worked on weekends, like, in the hospital too. I worked on the weekend, so it's not a big deal for me. There's not much going on in Jacksonville on the weekends anyway.
That's so funny. Well, I have other clients too who choose to work weekends and then choose to have weekdays off. I just feel like there's no right or wrong for that. It's like if that's what the days you, I also have a client that or a student that's an MFR therapist that works holidays. Yeah, if like holidays don't mean anything to you, or maybe holidays are painful and so it's better to work them. I think
Yeah.
it's just capitalizing on what is best for you and offering it. And if there are clients out there that want to come in for those sessions, you're gonna book them right up. So it's really
Yeah,
nice.
it helps because if you're willing to do things that most people aren't willing to do, then you get a leg up.
Mhm. Sure, sure. And especially if it's what you want to do. I think at the end of the day, that's the
Right.
most like important message I can relay is there's like no hack or no like right way to do it or special circumstance that you can create that's going to just make your business just wildly more successful than someone else. It's like, but when you want to be doing it that way and it is your choice and you're not shooting on yourself, I think that's where the magic is. And that's how you get fully booked is because that's what you want. And there's just a different energy behind it. So
Yeah.
that's what I want to put that little nugget out there.
Yeah. I have appointments that I need to do on weekdays, so
Yeah,
that's what
exactly.
I want to do.
Yeah, it's perfect. Okay, well, what would you say to people that are thinking about they're either thinking about opening up a practice, they've been to a few seminars, they've got the fire behind them that they want to be an MFR therapist. What would you say to them if they're thinking about doing that and joining coaching? What say you?
Oh yeah, absolutely. Yeah, it was totally worth it. Yeah, I had someone at a seminar who asked me, like I was eating lunch and she had asked me like for some advice, and I said I would just recommend starting coach like doing some coaching, because all of those questions that she had were like the answers that I had came from you. So
Well,
it
thank you.
was
I
definitely worth
appreciate
it.
I appreciate it. Awesome. What's your favorite part about being involved in this coaching program when you were in it?
It can get lonely being a solopreneur, and I think just having people around that I could bounce ideas off of, knowing that there's other people in similar situations, it's not just you out there,
Yeah.
and having the portal with your live coaching call, like you have live coaching calls that you can look back on,
Mm.
were helpful. I wish I'd looked at that more. Because when you watch it again, there's things that, just like when you take a seminar again, there's things that you just understand better if you rewatch.
Yeah. Well, and sometimes it's like you haven't had the exact same thing happen to you yet. And I'll say yet because everybody experiences pretty much the same drama in their MFR business. So maybe you're hearing someone be coached and then it doesn't resonate with you yet. But then you have that situation happen and you go back and you listen to it and you're like, oh, that's how they dealt with it. That's exactly, I can just implement that right away, which, yeah, I agree. I kind of love those call replays for that because I'm a big learner off of replays and just like listening to something kind of over and over again or listening to lots of calls while I'm doing laundry or something and where I learn my best stuff. So.
Sometimes I don't have the best attention span, so if it's, I mean, this is selfish, but if it's not pertaining directly to me, I will space out.
Oh, yeah, I do too. I think that's just human, right? And also your desire and your appetite for consumption of some of the information, it comes and goes, right? Like you can be
Yeah,
like all in for like 6 weeks, and then your brain can be like, I can't listen to Heather's voice for another minute. Or like maybe someone's triggering you in the group or whatever. You're like, I got to take a break for a second. But then it's like you can just jump right back in and get what you need when you need it. So you don't have to like
yeah,
be constantly barraged by like, is that a word? I don't know, like by everything going on.
yeah, yeah. I love that.
Awesome. Well, I thank you for your time today. Is there anything else you want to add about EDS or about what you would recommend for therapists? Also, tell us where people can find you before we wrap up.
I have social media. My handle is at Zest, M as in Mary, F as in Frank, R as in Robert. Well, I usually mostly do Instagram, Facebook. Website is Zest MFR. That's where you can find me. And I would say, I think that anyone with any condition, like it doesn't matter what the condition is, anyone can benefit from myofascial release. And I think especially people with hypermobility. So as long as you're adhering to the principles, you're being intuitive, you're asking questions, you're listening to your patient, you'll do fine. Don't be dictated by the diagnosis.
Yeah, that's so good. So good. And really something John would say, right? Like he would say, don't be intimidated by the label.
Yeah. I mean, if it's something that really worries you, like if you're, then just read about it. That'll help ease the anxiety.
Yeah. And ask questions. Never think that you have to know more than your patient
Mhm.
knows about what's going on. Because if they know more than you, they'll tell you, right? If you ask. And it's okay for you to not know everything about every kind of condition.
Yeah.
And hopefully you see all kinds of wild zebras in your office and you help them.
And don't assume anything. Don't assume, I mean, don't assume that you know your patient better than they know.
Exactly. So good. So good. Well, thanks again for being here. It's been fun to see your face. I haven't seen you for a couple weeks, so good to see you.
Good to see you too. Thank you so much. It's great talking to you.
For everybody that's listening, you can find Jamie at zestmfr.com or zestmfr at zestmfr on Instagram. And we'll have the links all available in the show notes. You can find Jamie there too. All right, everybody. We'll see you on another episode of the MFR Coaches Podcast next week. See you then. Bye. Thanks for joining me today. If you enjoyed today's episode, please take a minute and rate and review the podcast. I appreciate it. For more information, please follow me on Facebook and Instagram at The MFR Coach. And check out my website, www.themfrcoach.com, for more information. If you are currently not working 20 hours or less and making six figures in your MFR business, I want to help you change that. Make sure you tune into the show and get on my email list so you never miss out on important trainings and information. To be the first to find out when we are enrolling next for my 12-month Business Foundations coaching program, get on that email list at www.themfrcoach.com/join. Inside this program, you'll learn how to raise your rate, overcome objections, and sell MFR. You'll become the MFR therapist that never under-earns and never burns out. It's up to us to make MFR mainstream, and it starts with you and your successful MFR practice. See you next week.